Good afternoon. My name is Tom Partner. I'm a nurse practitioner, and today I'm going to present a lesson on the less dangerous things that cause eye problems. There are approximately 20 different disorders that can cause less dangerous eye problems. I've already covered 10 problems with the eye that must be checked for before one can diagnose one of the simpler or less dangerous eye problems. While I was going over these 20 different diagnoses that are less dangerous than some of the more dangerous, I did find one that could be considered more dangerous, and that was a gonorrhea infection of the eye. And I'll go over it in more detail when I get there. And remember, I did explain 7 different tests that a person should do, 6 or 7 that an examiner or practitioner should do when they're checking somebody who says they have pink eye or red eye or something wrong with their eyes. But anyhow, there are about 20 different disorders that are I consider less dangerous. They're not that they're not going to cause discomfort. They can cause discomfort, and they sometimes can be a little dangerous, but as a general rule, they're not that dangerous. I'm going to list them for you one at a time, and then I'm going to go back and give you more detail about each one of them. First one, blepharitis. Second one is trichiasis, not to be confused with the sexually transmitted disease trichomoniasis. Trichiasis is a disease of the eyelash or inflammation of the eyelash. A stye, otherwise known as the hordeolum. Chalizium, dacryocystitis, pediculosis, dry eye syndrome, keratoconjunctivitis, Zika, Sjogren's disease, viral conjunctivitis, bacterial conjunctivitis, gonococcal conjunctivitis, chlamydial conjunctivitis, allergic conjunctivitis, allergic acute conjunctivitis, seasonal or perennial acute conjunctivitis, giant papillary conjunctivitis, conjunctivitis medicamentosa, vernal ectopic conjunctivitis, immunogenic conjunctivitis, thyroid eye disease causing exophthalmos, pterigium, pineculitis, and subconjunctival hemorrhage. Let's look at all of these one at a time now. Now, like I said, just remember that gonococcal conjunctivitis can be relatively more dangerous, can become systemic, requiring IV antibiotics, so that probably should have been better listed under the dangerous ones. But anyhow, let's go back to the other ones and go in order that I just read. Blepharitis, inflammation of the distal and proximal lash. So it's an inflammation of the distal and proximal lash, and usually not dangerous. Usually you try to clean the eyelashes real well, maybe put a little Vaseline on them, and usually it's going to heal fairly quickly by itself. If concerned, you could put erythromycin ophthalmic ointment on there, as you can with some of these other ones. Trichiasis is a lash turn inward as the lashes are going inward towards the eye, the conjunctiva and the cornea, and causing an inflammation. So that's what trichiasis is. Not generally a big problem or a very important problem. It can be treated and without too much problem. Hordeolum or a stye, there's 2 different types. One is the external hordeolum or external stye, and the other one is the internal stye or internal hordeolum. And what you have to remember, there's two different types of things that get on the eyelids. One is called hordeolum and the other, or sty, and the other one is called a chelysium. So the hordeolum affect more of the towards the margin of the eye, so the eyelid. So what's the margin is considered to be the part that goes right between the end of the eyelid. This would be the end, and where the eyelashes start. That's the eye margin. So if you see a big bump or small bump there, it's probably going to be a hordeolum. Now, if it's a person has a big bump further back, then we call that a chelysium. And both of the hordeolum and a chelysium can be internal or external. Another problem that of the eye is a little bit of an infection of the duct that leaves the eye area. It's called lacrimal caniculi. So normally we have little ducts on this side, little duct on this side that allows the lacrimal secretions that are made by the lacrimal glands, and then that oily based watery substance covers the eye, the cornea, covers the conjunctiva, protects them, and then when it's done, it goes to these little puncture marks over here and here, and it drains to the nasal cavity. However, sometimes that can get clogged and can get infected, and that's what dacryocystitis is. So that's going to require an antibiotic to treat, and it should be followed up by an ophthalmologist. Pediculosis, that is lice or nits right on the eyelids, usually again towards the eyelid margins. This again can be treated with what I said before, erythromycin ophthalmic ointment, or sometimes simply Vaseline. Dry eye syndrome. So a person can have dry eyes for a couple different reasons. One is that the glands, the lacrimal gland, which lies somewhere up in here, is damaged. There are some disorders of the body, we'll talk about it soon, that cause it's an autoimmune disorder where the antibodies attack the saliva glands and the lacrimal glands. Therefore, those lacrimal gland does not function very well, and therefore it causes a problem lubricating the eye. There's another reason too, that we rely on nerves to tell those lacrimal ducts, lacrimal glands to secrete. So if there's nerve damage, a person can also have a problem with not having enough lubrication on their eye. And one of the things that can happen as a result of not having enough lubrication of the eye is called keratoconjunctivitis sicca. So keratoconjunctivitis sicca is basically dry eye. Now it causes some sort of a scratch. So the scratch could be on the cornea. The scratch could also be on the conjunctiva. Naturally, we're more worried about the cornea, because the cornea is the lens to which we have to see, and if there is difficulty with the scratch there, it's going to be hard to see. Sjogren's disease is a disease of the lacrimal gland and the salivary gland. So this is a disease, this is the autoimmune disease that I was talking about, that is going to cause a person to have both dry eyes and dry mouth, and it's because the antibodies have attacked these glands and caused them not to secrete well. Again, that can result in keratoconjunctivitis sicca. So We have to be concerned if there's a dry eye, we need to treat it. Viral conjunctivitis. It's probably 90% of or more of all the complaints of pink eye are caused by viral conjunctivitis. This is usually a thin, watery secretion, and it usually occurs approximately at the same time or a little bit, maybe even a little bit after a person has a cold or the flu. There's no treatment for it, it's simply waiting. Bacterial conjunctivitis. So one of the ways it can be tested for, we can test for the bacteria in the eye, but also another method of determining is by history. If the person says, their eyes are stuck together during the morning when they woke up, and then throughout the day they've seen this yellowy discharge or whatever color discharge it is, and it continues throughout the day, they probably have a bacterial infection. And generally we treat this with an ophthalmic eye drops. Usually I use Cipro or azithromycin. Azithromycin's a little bit more expensive, but it's more convenient. Don't have to take it very many times a day. There's other people use some other ones. I would try to stay away from those that can cause an irritant or an allergic reaction. Those containing a sulfur medication and gentamicin are possible irritants to the eye themselves. They're not going to solve the problem, they may make it worse. Well, actually they could treat the bacteria, but then give a person another problem. Gonococcal conjunctivitis is the one I said which probably should be considered, I should have named this as a dangerous one. It doesn't happen very often, and the way it's described in a textbook is that a person is going to have thick, copious drainage. That's lots and lots of drainage. Okay, so if you ever have a person who's sexually active that could possibly have gonorrhea, then you can think of that maybe they have gonorrhea in their eye. And this can happen to both adults and children. Children as they're vaginally delivered, and adults who have gonococcal infection in general and then go and touch their eye. They will have to be treated in the hospital usually because they require an antibiotic, usually Recefin, Q12 hours until the infection has been eliminated. Another disease is a sexually transmitted disease that can get in the eye is chlamydial conjunctivitis. Now usually this is a stringy mucoid discharge, and this could be confused with a viral or allergic conjunctivitis. The only thing that to tell them apart clinically is the history. So if there's no history of allergies, there's no history of virus, flu, and influenza, then we have to suspect, and there is a history of or potential for sexually transmitted disease, we have to consider the possibility that this person might have chlamydial conjunctivitis. Now generally this can be empirically treated with doxycycline 100 milligrams BID times 1 week. Just like if the chlamydia was in the genitals, this treatment is the same. There are a variety of types of allergic conjunctivitis, and some of them have more specific names. All of these should give some history, though, of a history of consistency. In other words, some people who have allergic conjunctivitis, they can tell you they're going to have it every spring, they're going to have it every fall, they're going to have it with some stimulus that's going to cause it routinely. So allergic conjunctivitis is diagnosed partially by the symptoms of big symptom here, very important symptom is itchy. Most people with viral or bacterial conjunctivitis do not report being itchy. Allergic conjunctivitis, they usually do report being itchy. And they're going to have their watery discharge just like viral. It's going to be a watery discharge. The difference is the history. Another type of allergic conjunctivitis is seasonal or perennial acute conjunctivitis. You know, and when people start to have these things on a regular basis, the tarsals, the inside part of the eye, there's papillae tend to get larger. So when somebody has seasonal or perennial allergic conjunctivitis, you just may start to see these little white papillae on the inside of the tarsals. If somebody, in some cases, these papillae become very large, and we call this giant papillary conjunctivitis. There is a type of conjunctivitis that a person can get from instilling their own eye drops. Sometimes these eye drops are prescribed, and sometimes people get over-the-counter medications that seem like they would not cause a problem. One of these is blef-10, and the blef-10 is because the preservative in that eye solution is an irritant to some people. There's other things like contact lens cleaners, like I said, antibiotic drops that can contain sulfa, and gentamicin may also cause conjunctivitis medicamentosa. Getting back to allergic conjunctivitis, we also have vernal atopic conjunctivitis. It happens every spring. We also have immunogenic conjunctivitis. This is like a conjunctivitis that occurs with a person who already has an autoimmune disorder such as lupus, rheumatoid arthritis, Graves' disease, and again they may have these big papillae on the inside of their tarsals because they have this type of autoimmune infection going on a great deal of the time. We also have some miscellaneous causes of eye disorders. The first one being thyroid eye disease, exophthalmos disorder, where the eyes appear to be bulging out. In fact, they are being pushed out a little bit, and that's due to a thyroid condition, and usually that's going to require an endocrinologist to treat that. It may require radiation, it may require surgery to remove the thyroid, it may require just medications. We also have two types of overgrowths that occur on the conjunctiva and sometimes the cornea. The first one is called pterigium, and that is like an overgrowth of tissue. It does not have a nodule, which is going to separate it from another type of overgrowth on the eye called a pineculitis or pineculitis. Neither of these is reason for much concern unless they start to cover the cornea and therefore reduce a person's vision, in which case they will most likely need to be surgically removed. And the last non-acute, non-dangerous eye disorder is subconjunctival hemorrhage. So a subconjunctival hemorrhage might look sort of bad, but in actuality it's usually due to being bumped in the eye, a strong cough, strong sneeze, straining. Any of these things can cause a little hemorrhage in the eye. And this usually will resolve itself in a couple weeks. It's usually presents, it doesn't present like conjunctivitis because usually it has a spot on the eye, which is mainly red, and from there it radiates out. Okay, unlike uveitis, which is going to radiate out in all directions, and unlike conjunctiva, which is going to have its injections coming in towards the eye, this has a spot, and from that it spirals out. So it has its own typical pattern, which is suggestive of a subconjunctival hemorrhage, and usually the person is able to tell you that they have had a history of straining or sneezing or coughing or some type of trauma. So that lists approximately 20 different what I consider non-dangerous eye problems. Let's go through them real quickly one more time. And remember, if you do all the proper eye test, you're going to be able to make sure that you don't have those very severe eye problems that are going to require immediate attention. Remember, blepharitis, it's the eyelids. At the eyelid margin, you're going to see a little inflammation, and that can usually be treated with, like I said, little Vaseline, erythromycin ophthalmic ointment. Trichiasis is the eyelashes turned inward. Hordeolum or stye is a inflammation of the eyelid towards the eyelid margin. It can be internal, external. Usually not a problem, does not usually require any treatment. In the cases that internal chalazion or internal hordeolum would be scratching the cornea or the conjunctiva, at those times, those may need to be lanced and opened up so that they stop doing that. Remember that the chalazion is away from the eyelid margin. That's what separates it from hordeolum. A dacryocystitis is a plugged up lacrimal canalicula, or punctate there. It's clogged so nothing can get through it. It causes an infection. Usually it's going to require some antibiotics. Pediculosis, it's lice, usually on the proximal eyelid or the eyelid margin. Usually again, Vaseline or erythromycin ointment. Erythromycin ophthalmic ointment. And then we have dry eye syndrome caused by a lack of secretion from the lacrimal glands. Can be either from poor nervation of the lacrimal gland or from damage to the lacrimal gland itself. Keratoconjunctivitis sicca is a scratched cornea or scratched conjunctiva as a result of dry eye. Sjogren disease is a disease, the autoimmune disorder where the body's antibodies attack both the lacrimal and salivary glands, causing both dry eyes and dry mouth. Viral conjunctivitis is the conjunctivitis you're going to see most often, but again, you're going to have to make sure that it is indeed, try to rule out these other things that are more dangerous. Bacterial conjunctivitis, I didn't put this in a dangerous category because actually, according to the literature, even a bacterial conjunctivitis will actually correct itself if given enough time. But anyhow, most people don't want thick pustular drainage from their eyes, therefore they request antibiotics, and we usually do treat it with, or at least I treat it with Cipro antibiotic ophthalmic eye drops or azithromycin ophthalmic eye drops. The one type of conjunctivitis that I do think should be considered dangerous is gonococcal conjunctivitis, and like I said, this should be more obvious with copious green discharge, or copious discharge, not necessarily green, could be green, yellow. Color is not that important, it's the amount that's important, and what's going to need treatment is to have be treated with probably Rocephin twice a day in the hospital. Chlamydial conjunctivitis, again, determined mainly by history, lack of absence of virus, lack of absence of a recent infection, cold, no recent flu, no recent cold, can clue somebody into the practitioner and think, well, maybe this guy's got chlamydial conjunctivitis, especially if they're sexually active. Allergic conjunctivitis, there are lots of different types of allergic conjunctivitis. There's seasonal, or otherwise known as perennial conjunctivitis, there's giant papillary conjunctivitis. And remember, when people have allergic type processes, they get these papilla on their tarsals, and they can become quite large. If they become quite large, then we consider giant papillary conjunctivitis. We can also get conjunctivitis from medicine. We call this conjunctivitis medicamentosa. So be careful what eye drops the person is using or is prescribed. And then we have our miscellaneous types of conjunctivitis. Actually, not conjunctivitis, it's something, a problem of the eye, which is not that difficult. It's called exophthalmos. We have overgrowth of tissue on the eye, both pterigium and pineculitis. Both of them are not a problem unless, of course, they overgrow the cornea, causing a decrease in vision. And lastly, we have subconjunctival hemorrhage, which is usually caused by a small trauma to the eye, either a cough, sneeze, strain, or a direct poke in the eye or something like that. So, in conclusion, we have about 12 dangerous types of eye problems and approximately 20 non-dangerous types of eye problems. If we do those 6 tests that I talked about earlier, 6 or 7 tests on an admitted complaints, and look at them closely, we should be able to determine most of these, some of which are, if we consider something dangerous, then we need to send that person either to an ophthalmologist, the emergency room. Otherwise, we can treat most of these other problems in the office and have a close follow-up with them. So thank you for listening to my lecture, and have a great day. Bye-bye.